Welcome to Medicine in Our Backyard. This is a series presented by the Newport Beach Public Library Foundation in partnership with UC Irvine Health. My name is Adrienne Windsor, and I am now a board member emeritus. Still having the privilege of coming and introducing our speakers and saying hello to you on these very special Monday nights. So we'd like to thank our generous sponsors, Mike and Polly Smith, who've been with us since the founding of Medicine in Our Backyard. And we'd also like to thank UC Irvine Health for their sponsorship, and also for the work of Kunga, our program director, and Jane Merritt, who organize all of this for us and do such a fine job. Thank you. A quick bit about us. The Library Foundation is a membership-driven organization. Our mission is to support this library and to fund valuable library resources, services, and programs. Can I see a show of hands? How many are members? That's quite a few. We hope to have more. We have a wonderful new statistic. This year, the foundation is sponsoring 44 programs, and 32 are free. And this is one of them. And Jerry was just telling you about our new free will that the foundation is offering. We provided the funding for the Media Lab, for many of the part of the fine collection of ebooks with magazines, books, films. We do so much to support the library. And then the foundation also accepted the obligation to fund half of the proposed new Whitty Hall, which is a huge undertaking for Jerry Capel, our CEO, and he's made extraordinary progress with that. So if you're not a member, please join. Kunga's in the back of the room. She'd be happy to sign you up tonight. You find out early about our Whitty lectures and our Library Live lectures, and we've just begun offering series memberships, and our first Library Live speaker was totally sold out, and our next Library Live speaker is totally sold out. So these are popular programs. Steve Lopez, some of you may read his column in the LA Times, is coming in November. And we do have a wait list, so in case you're interested. All right, so now a few reminders. We'll have a Q&A session at the end. So if you'd please hold all of your questions until then, that would be helpful. Now, if you haven't silenced your phones, this is a good time to do it so that we don't have interruptions. And I want you to know I turned mine off. All right, so I'm happy to introduce tonight's speaker. This is Dr. Julie Rousseau. She is a project scientist and director of strategic initiatives in the Department of Family Medicine, Division of Geriatric Medicine and Gerontology, and a volunteer clinical professor in the School of Nursing at the University of California, Irvine. With Dr. Lisa Gibbs, she has worked on the launch and design of remote patient monitoring at UC Irvine Health, healing at home virtual care, and EMR embedded digital health engagement score, and the creation of a digital health engagement center. This is the world we are living in. We might as well get used to it, and I'm glad Dr. Rousseau is going to be here to tell us about it. Currently, she is working on pioneering digital health pilots to support older adults and establishing our digital ecosphere at the Senior Health Center. Tonight, she will be speaking to us about technology-enhanced healthy aging. Oh my, it's come to that, trends and transformation. So please join me in welcoming Dr. Rousseau.
Good evening, everyone. Thank you for this wonderful opportunity to spend some time with you tonight and to talk a little bit about the expanding nature of digital health. I'm a researcher and I'm advanced practice nurse, so I have both clinical as well as academic work that I do for UCI. I do have a few disclosures. I have no financial interest in anything I present tonight, unfortunately. No, I don't. And on top of that, I'm showing you examples of technology. We don't endorse any of the specific technologies I'm showing you. A lot of it is experimental, so it isn't even available on the market. So I'm just trying to show you trends and transformations, but these are not necessarily things that are consumer available. When we get started, a lot of what you're going to see tonight is from the Consumer Electronics Show, or CES, where I have been active for many years. The CTA Foundation, which is their nonprofit arm, focuses on persons living with disabilities as well as healthy aging. So AARP started joining the Consumer Electronics Show, which is the largest show of electronics in the world, with 400 square foot booth. Fast forward to last year, they had 7,000 square feet. So health as well was a very small part, and now it covers enormous space. And the three themes that AARP held conferences about during CES were age tech for self, so how technology can help empower individuals, age tech for health, and they really leaned in on home-based healthcare and technology, and 5G for age tech with smart homes and smart cities. So my talk's gonna mirror some of that. You'll see some of the themes as well. But let me get started with a little poll. So I'm gonna ask you to raise your hand if you had a telehealth visit with video, so you saw your doctor, your nurse practitioner, your physical therapist before the pandemic. So think back, like 2019. Raise your hand if you ever had a telehealth visit. Fantastic, so we have 2 people. Okay, let's fast forward to today. How many of you today have had a telehealth visit with a video? Okay. So how many of you use a digital device? And what I mean by that is a blood pressure cuff, or maybe your smartwatch, or a scale, or an O2 that goes to your phone so that you have an app. Any of you use any of those devices? Quite a few of you. And how many of you have those devices connect to your healthcare provider? So if you take your blood pressure at home, they see it. Any of you in a telehealth? We have 1 person. Okay. So we're going to talk about some of these trends and what happens. And then the last question I like to ask is, raise your hand if you like technology. It's okay to not like it. Okay, cool. So the reason I ask that is when I speak to physicians and nurse practitioners and nurses, it's the single factor that drives whether or not they will use digital health or video. It's whether they like it or not. And the American Medical Association has been tracking this for years. And again, the pandemic made people more interested, as well as physicians and nurses, in using digital health. So we all went along that change. Today, my big themes are going to be about wearables and sensors, connected care, digital and virtual healthcare going forward. What do we see are the trends? Smart home technology, and also some new trends in accessibility, innovation, how technology is going to help us move forward. And we're kind of thinking about the next 3 to 5 years. What are some things we're going to see? But I do want to take a moment to talk about the pandemic. And before I talk about the big changes, I want to acknowledge the profound loss that many of us faced. And those of us who work in geriatrics, this was a really profound watershed in healthcare. So it made us accelerate our healthcare, our digital health, and our telehealth program. And it also exposed disparities in a really stark way. And we're very aware of that when I talk about what we're doing at UCI and some of our research that came out of the pandemic. I want to be really aware of that with you. So telehealth was expanded, as we saw in the room, profoundly during the pandemic. But let me give you a few numbers. So according to the Government Accounting Office, in the beginning, before the pandemic, the total annual was about 5 million, right? At the height of the pandemic, 53 million. Okay, so 5-fold services, and that's over a few months. They're tracking it by month. So it went from being a tiny percent to being quite large. And one of the things we saw is that in the pandemic, we had a stay-at-home order. And so people began to use devices as healthcare devices, like your watch could tell you your O2 sat. Also, people began to manage their chronic diseases more at home because we weren't having people come into the clinic. Huge amounts of data were being collected and are being collected. We'll talk about that later. Think about COVID testing. Suddenly we all opened labs in our home and diagnostics moved not from you coming into the clinic, but at home. Smart homes and smart accessibility was a big one. And at UCI, we launched many new initiatives during this period. So improving chronic disease care. I'm going to give you an example of hypertension management. So we know that as people age, they have a heavier disease burden, more likely to have chronic diseases that are being managed. So this is the technology, right? You're familiar with this, right? You've been in the hospital or you've been in a clinic, and these are the devices that we use. It's the ones I trained on, right? You have a stethoscope and you pump up an arm. This technology is from the 19th century. It's not even from the 20th century. Some improvements were in the 20th century, but the big breakthrough. The other problem with this technology is that we use it in clinic, which means you have to come to us. And we take your blood pressure in clinic. We diagnose if you have hypertension, right? And then we want to check you, so we have you come back again. So it is a real burden on patients. And what research has found is that it also is highly inaccurate. So think for yourself when you go to your provider, right? You got to park, you have to walk, you go to a waiting room, you have to get to the room, maybe they put you in a gown, really uncomfortable. Well, guess what? When we take your blood pressure, it might be a little elevated. Correct? And one of the things across the UCs that we've studied is that the best blood pressure readings in clinic are when you're leaving. That's more accurate. That tells me what your blood pressure is like at home. But the U.S. Preventive Service Task Force, which sets the guidelines for primary care, actually recommends that hypertension not be diagnosed in a doctor's or a clinic. It should be diagnosed by having someone at home taking their blood pressure. In your life, are you hypertensive? What does that look like? So taking blood pressure twice a day at home. That is a better way to manage and diagnose hypertension. So what devices are out there that are making that possible? So these are the new devices. And even in the past 3 years, it's changed profoundly. So it used to be that if I gave a digital cuff to a patient so they could go home and take their blood pressure, they needed one of these. They needed a smartphone or the internet to connect the device. Not anymore. The new devices actually are cellular enabled, so when you take your blood pressure, it can pull right into the medical record. So if I'm really wanting to watch a patient, I can real-time intervene. Well, the hypertension is not being managed. The medication isn't working. So we see this as the Withings device over on the left, and Omron as well has these cellular-enabled, connected diagnostic devices. They're as accurate, and when I say VDL approved, it means that they're validated devices by the American Medical Association. They've been tested, and they are accurate devices. The other one is the Cardia card. This one actually can give us clinical grade EKGs. And so we can actually watch what's going on real time. It's about the size of a credit card. So again, we see that these devices for managing disease are moving quickly ahead. I tried on the watch up above, that's a wrist, and we don't like patients using wrist blood pressure cuffs. We mostly want them using upper arm measurements. This is not available or FDA approved, but they're getting very close to having highly accurate wrist watches for doing blood pressure. And again, the Apple Watch is a great case to see how one device actually gives us a lot of metrics. So you don't have to have 5 different devices. Currently, it will tell us oxygen, heart rate. It can give us ECG capabilities, temperature, fertility tracking. It's a personal emergency device, right? It has a fall detection on the watch. And it even has satellite connection. Did any of you hear how there was a young couple who got in a car accident and their watch called through satellite 911? So this is an increasingly sophisticated device. The Apple has been very advanced in their research. Omron announced at CES that they were going for 0. And what they meant by that was that they were going to manage your hypertension, and they want a world where the next generation won't be defined by age. Heart attacks, strokes will not be. The cardiac problems we face today will not be faced in the future. And so they are piloting in England right now. There's a study called Tasman that the NHS, the National Health Service, actually ships these devices, and patients manage their hypertension, including their medication, on their own with tremendous results. Again, the technology puts the power and the decision and the management in the hands of patients. So we anticipate seeing more of this, where there's kind of a direct-to-consumer chronic disease management model. Now, many of you will also be familiar with diabetes management and how much technology is impacting that these days. So with diabetes management, have any of you used or seen these Freestyle Libre or Dexcom? These are small devices about the size of a coin. So these first debuted in 2017, and what this allows for is using interstitial fluids instead of blood to manage diabetes. And so the one device, can last for 14 days with no sticks. And again, on your phone, there's an app that will help you manage your diabetes real time and your insulin management. And we see this a lot for kids as well, but this is a fast-growing, continuous blood glucose monitoring. So again, it's not just one reading, it's continuous, so that we get a lot more data and we can help you better manage your health. But guess who discovered these devices? Elite athletes. And one of the big growing areas are that people who just want to have healthy age study how their nutrition impacts their well-being. And it's considered preventative too, so that people who are at high risk for diabetes, we can monitor them. There's also a watch, which is the new technology, not available, but it is being tested, that uses light sensors to get at, again, blood glucose. And Apple's working on this as well. So you're not having to be stuck to see and manage diabetes. Well, again, these are our old tools, right? When you go in and you think about a physical exam, we use otoscopes and we use stethoscopes to do this. Now, how did this work for us during the pandemic? It didn't, right? Your telehealth video visit was basically us looking at each other and reporting how you felt. So there's no real physical exam. There's no real data in that. So these are two devices. I'm more familiar with TytoCare on the right. Have any of you used TytoCare or explored this one? MediOne is actually in Orange County, so it's another device, a single device that you're able to do a full physical exam, even remotely. So with TytoCare, do I have a clicker? Okay, there. TytoCare teaches you how to do your own exam. The middle probe is a stethoscope, and it shows you a picture and where you put it, and the data is transmitted directly to your provider. So if you think of rural health and global health, Tyto is a game changer because you can look at a child. It's marketed primarily for pediatrics, but I always have a geriatric lens on. And I think of our patients, or I think of families who have dementia, persons living with dementia, and how difficult it is to bring someone into clinic. So the ability to do a full physical exam without having to transport, and having a caregiver or a loved one do that exam. And I think about mobility. When people have a hard time getting around, these devices enable us to use it. And I can say from personal experience, because full disclosure, my father lives in an extremely rural area. He's 90 years old. He lives alone. He is far away from anything. 30 minutes to buy milk. I kid you not. Tyto is how that we were able to help keep him healthy, particularly during the pandemic. So we can get cardiac reading. We can look in his mouth, get high digital if there's a bruise or a sore. So this is used by a lot of healthcare systems increasingly. So now we're going to talk about something fun. And when we think about labs at home and diagnostics, the real breakthrough was pregnancy tests, that you didn't have to come in the privacy of your home with no one else knowing. You could pee on a very affordable stick and find out whether you were pregnant. That was revolutionary. Well, then we had COVID, and everyone opened a lab in their home. And contrary to what everyone thought, we actually did a great job of swabbing and diagnosing. It worked. And so now there's really a lot of research and development in home-based laboratory tests. And you probably know this from genetics, right? There's a lot of direct sort of things you can do at home. The new one that I saw that really was quite fun is urinalysis at home. And this was announced at CES. It's from the company Withings again. This is called UScan, and it sits in the toilet, and it tests over 3,000 metabolites. And there are cartridges, so you can put it in if you want to check for UTI, if you're trying to track someone for end-stage renal disease. You can customize what the data is being collected. It's used in Europe. It's available in Europe. It's not yet FDA approved in the US. But up to 7 family members can use this device, and it tracks. It also can do, it's about 3 months worth of lab tests. So again, we're getting a lot of data. It's not just one. And think about someone who has maybe some cognitive challenges and the difficulty of taking a urine sample versus just going about your daily life. We're able to collect data that we can use. So hydration level, renal disease, and I think about SNFs and assisted living and nursing homes and dementia, and I think this is a game changer, particularly from my years of being a nurse. This is a really great way that we can use diagnostics at home. This is not new. There are also smart toilets that weigh you and get metrics, and there is also another direct-to-consumer, unlike the Withings product, that does test sort of basic home screening. So we talked about devices that, like Tyto, that you can do physical exams at home. These are the highest end of that, and they're small devices that are placed on the chest, and these provide continuous ICU level readings, and these are FDA approved and in practice. So this is called the Bio Button, and if you think that your standard hospital stay is vital signs 4 times a day. This is providing 1,440 readings a day. And what this enables us to do, and UCI works with a company called Bioformis, is to begin doing hospital-level care at home, which was a big important thing that we tried and wanted to do during the pandemic. So these small devices, again, allow early discharge, and it allows for people to be able to go home and for us to still get data. And it's, thank you.
Is it forward or backward?
It's forward. I can do it.
Perfect.
Thank you so much. I appreciate it. So there's the bio button, this one, and then there's something called the Zio patch. And there's a lot of new ones coming on, but they also have a big AI background, so they do early alerting. So if there's a change, we get early information that maybe O2 sat is falling or heart rate is falling, but it's from the comfort of your home and privacy. So again, when we think about at-home care and at-home diagnostics, it also allows for access without stigma. And, you know, if we think about things like sexually transmitted diseases, or we think about infectious diseases that there are stigmas about, this allows you to privately know what your health is without even having to have necessarily an interface. It also prioritizes patients that need to be seen. So if you're COVID negative, you may not need any health care, but if you're COVID positive, when our healthcare system was overwhelmed, it allows us to triage patients that need resources and need support. It's personalized, it's precision medicine, and for persons living with dementia or those with physical challenges, a lot of this technology that I've been showing you today will hopefully improve access over time. So if you're struggling with transportation, being able to have some of this at home. Okay, so, I'm sorry, I didn't have the slide up. So these are some of to kind of put a bookend around what some of these at-home diagnostics and at-home readings, some of the potential for it, that it prioritizes patients, that it allows for personal and precise precision medicine, as well as expanding access for those who have challenges in mobility or transportation. So I showed this to students, and they had no idea what not ready for prime time meant. But hopefully some of you know. These are things that I'm going to show you a technology that is really early. This is really early, but it is going to happen. So Neurologics announced, and this is really where all my physician friends were hanging out with this company, that basically you could use a cell phone. And this is being highly researched. And your cell phone would use something called transdermal optical imaging to be able to look at capillary flow in the face. And what it allows for is heart rate, blood pressure, a huge amount of metrics. It's a Canadian company developing this technology. It is validated in Europe for blood pressure, that your cell phone, again, is a very powerful healthcare device that we don't think about. But for global health, the WHO supported doing blood pressure screens through the cameras on the phone. So Neurologic, had this. You could come up and they'd take a selfie. This is their test case. It's called a Neura, and they do all kinds of predictive analytics based on what a video of your face tells them in terms of metrics. And they use a lot of AI and predictive analytics. But I assume that this is something coming. So when you're doing a Zoom, the camera for the Zoom for your telehealth appointment is going to also be able to give us health metrics based on the video alone. So smart homes and smart cities. At UCI, we are leading Orange County right now in something called the Dementia Friendly Initiative to make Orange County dementia friendly, and we're very committed to this because of equity and access. So at home, our homes are dangerous places, right? Where do falls happen? Where do people get hurt? A lot of times it's within our homes, and it's also within our streets and cities. And so the technology has the promise of helping us as we age stay healthier in our homes and in our cities. And some of the technology I'm going to show you is just coming forward. So probably you've heard of the curb cut example, where the curb, if you think of the curb, was a huge barrier for people in wheelchairs. And so when the curb was cut, it had a huge impact on our cities because Amazon, postal, strollers, it wasn't only wheelchairs that benefited. And AARP has been very strong about the fact that technology designed for all benefits that you don't recognize. And PERS is probably one of the big examples of this, which are personal, those little devices where you press a button if you're home and you're in trouble. That's proliferated into a whole ecosphere of safety at home devices. And as we think of this with caregiving and family and people who may be separated from their loved ones, Charlotte Yeh, who's the chief medical officer for AARP, stressed that aging at place is a very old idea because the pandemic taught us that wasn't necessarily healthy, that staying at home actually had some negative health impacts for people. And so she is promoting thriving in motion and really advocating for safe cities, and that we need to protect pedestrians and we need to have more technology to make our cities age-friendly and make them safer. So some of the technology I'm going to talk about is, again, to make your home safe and to make communities safe. So radar is one of the new things. It's being used in assisted living right now, or nursing homes, or SNFs. It again allows for enormous amount of passive data collection. So you don't have to put a device on someone. You don't have to connect electrodes. Radar is able to see heart rate, breathing patterns, respiration, and give enormous data to be able to manage healthcare. These are some other devices. Care Predict is, again, a home safety device, so that as you are doing your home health readings, there's predictive technology to help you, or if you have a caregiver who is not in the same state, which is a big national issue right now. A lot of people live very far away from their families and connections. Care Predict was one of the CES award winners. The little robot on the right is a little tiny sensor that does emotional sensing based on voice. So when people have voice changes, it debuted as well. The one in the middle I'm really fond of. It began for elite athletes. And it's able to see, if you think of PT, I'm looking at you and I'm looking if everything's right. This is doing it with sensors. So it's able, because elite athletes, every move they make matters. This tells a physical therapist if you're actually doing the exercise correctly. Are you weight bearing? And so we know PT at home is a very fast growing industry. This is the technology that's going to move that really rapidly forward. Anyway, there's a lot of home-based stuff. When we think about accessibility and function and support, it's important to think about how the technology helps us live safer and better. And again, I lean into families with caregivers who have dementia. And some of these devices allow for very passive. You don't have to step on a scale with the BB mat. It's just a bath mat, but it actually will give me weight. It'll tell bone density. It will tell whether you're carrying water weight versus muscle. It'll tell whether your weight is evenly distributed, but it's just stepping on a bath mat. And it'll do it for more than 100 unique members. So again, in something like a SNF or an assisted living. Ashidase on the right is a navigation device for people who have visual acuity challenges. It tells you what's in your way, and it also will navigate for you, but it's built into the shoe. So it's kind of built into, these are devices that are built into daily life at home or through the city. Glasses. So beyond glasses, let's think for a minute about, not that many of you wear glasses, but for those of you who do wear glasses, they really are incredible vision aids, but they can also be hearing, right? It sits on your, so there's a lot of new development in hearing capability with glasses. The other thing is it sits along your temporal. So for seizures and people who are trying to manage brainwave, glasses are another, if you look on the zero glasses on the right, it's a way in which a single device can actually be used much more effectively in terms of health management. Hearing aids, so August 16th, 2022, the FDA announced that they wanted to expand hearing access. As many of you may know, they made hearing aids much more widely available. And what AARP said is, stop designing hearing aids only for people as they age, because every kid has earbuds in. So being able to have translation capabilities, making them cool, like come up with some better designs. The ones on the right purify air around your face, but really active lifestyle design. And we're anticipating a lot of innovation around hearing aids and what kind of fun music and integration can happen in the space. Sorry, these with hearing aids. So the ones on the right have the purifiers. In the middle is my favorite device I saw at CES, because I don't brush my teeth for 2 minutes faithfully twice a day. And I certainly have had lots of patients where that's a challenge to give oral hygiene care. This is a device available in Europe, not yet in the US. And what it does is, in 10 seconds, it brushes your teeth with 35,000 bristles. So you just put it in like this, and your teeth are brushed. Yeah, so I think that's a game changer, and I think this thing that we use, even the electric one, is really, like, again, old technology, so bring on the new toothbrushes. The one on the right, remembering to charge things can be a problem, so this is a data sensor watch band that charges itself. And again, if we think of global health, we think of emergency disaster, which I do a fair amount of work in for older adults' resilience in disasters. Something that is not requiring electricity is really appealing. And on the right, again, this is a toilet that not only washes, blow dries, hands-free, cares for you, but helps you stand up again. Okay, so I couldn't completely move away from robots. I'm going to talk about them just for a minute. It's not my area of expertise yet. But with mobility, exoskeletons are important. And again, as a nurse, lifting patients is a real challenge. I know I'm really tall and huge. So this device, again, dual use, was designed for warehouse workers to be able to lift without putting burden on their back or lower back. But I think of home healthcare workers too, and people who provide care and need to lift to keep patients safe, or loved ones safe. The device on the right serves that. And this middle one was designed for surgeons. It came out of Japan, and it's the same weight as when you're sitting, but you're actually standing upright, because surgeons who do like 10-hour surgeries, this device in the middle. But think again, this could be incredibly useful as we age, or keeping our exoskeletons healthy. And on the right is an autonomous wheelchair, which was amazing, that moves around and can navigate freely. Privacy and trust, this is really important. It's your data, so you own it. And we need to have in this country a lot more transparency about where data is and about privacy. So I wanted to take a minute to say that. I'm very aware of this, and I think it's something that we should all be advocating for. My favorite story is a patient who told me that they didn't want to use the EMR and they didn't want to be involved in it. And I said, well, what do you like on your cell phone? And she said, TikTok. I was like, well, I have some bad news about where your data is now, because they're tracking everything you do. Companies, Amazon, all of them, they own your data and they track you. So we need to take that back and own our data, particularly our health data. So in conclusion, I'll just say it's important to stay on top of healthcare trends and think creatively about how this technology empowers you and helps you make decisions about when, where, and how to seek healthcare. It should be simple and direct so that you're able to get more information in your hands to make decisions. AI is great, but it needs to have actionable, something that changes. It needs to have outcomes. You know, we want to improve health. That needs to drive everything with empowerment. Social justice and improving access is always, always a part. I work for a public university, UC Irvine, and we are always concerned about everyone and having access available, and democratizing healthcare. So here's a statistic to think about. 1/3 of all data collected in the world today, and this is a quote from Stephen Klasko, is health-related. And yet, 95% of that data is not used to keep people healthy. So we need to start really making sure that the data we have and the information we have improves our health, our healthy aging, and our outcomes. At UCI, we've launched the digital health, which we call the Health Equity Access Learning and Technology Hub. And our goal is really to make technology accessible and to have our students engage directly with our patients in this. So at our senior health center, we've opened a digital engagement cart, is what we call it, and it's available for anyone who comes into our senior health center to learn how to use a smartphone or how to message their provider or get a prescription refill or read a lab result. And we're very engaged in having our digital natives, these are my nursing students, volunteer and help make sure we have equity. So we did a little pilot research on this, and we're continuing to move forward. So future challenge, of course, climate change and disaster, technology, dementia care, and dyad care. We have a real crisis in caregiving in this country, and some of the technology I'm talking about is to make sure that we have the healthcare workforce in the future. And I have my colleague, Dr. Jung Ali, who uses technology to study caregiving. She has information in the back for people who are caring for family members with dementia. And we use a lot of technology in that. She uses a smart ring, and so I think these are some of our future challenges that we can, and dementia is, of course, a huge growing problem for the state of California, as many of you are aware. We work very closely on a Governor Newsom initiative called Dementia Care Aware. And robots, I'm going to end on robots because here come the robots. UCI was recently awarded a grant to study how robots can work with human caregivers. And we're just starting on it, but we think that the future of work and the future of healthcare is going to have to evolve because of the demographics using more. So thank you all for your time. I hope that was a good quick tour of the lay of the land of things that are out there or coming. I welcome questions, comments. Thank you so much for your time and attention.
Is dementia rising more in California than in other states, or is it just being studied more in California than in other states?
It's a great question. I think, our national capture of dementia, we don't screen for dementia, is first of all a national problem. Full stop. It is very underdiagnosed in the early stages, and that's what Dementia Care Aware is trying to do, is to promote early screening so that we have early information. If you think of clinical trials and breakthroughs, they all happen in the early stages. So yes, California is ahead, so we probably have more robust numbers in terms of the number of demographics, but it is just also because we're a very large state. So when we say, 1 in 5, we are seeing real epidemiologic rises in the incidence of dementia in the state. It's now a leading cause of death, which it was not. That's national as well, but probably to your point, we collect data well in California. So I don't think all states equally collect data or diagnose or screen. It is a problem. I mean, dementia is under-researched and underutilized. I mean, we haven't put enough focus on it yet, but we're working hard to try to change that. Did that answer your question?
You mentioned this smart watch for blood pressure, and it'll lead to other things, and it collects a lot of data. I realize you probably don't want to endorse anything per se, but are there a lot more pluses with that system than, say, other systems? I'm assuming it's very accessible for most people compared to others.
Thank you. Yeah, I think accessibility is a big thing, and I do think about that for patients who are struggling with cognitive challenges. Putting on a cuff and having it inflate can actually be kind of scary. And so it's also out of your normal day-to-day, right? Like, none of us have a cuff that's part of our life that we squeeze our upper arm, whereas a watch is really accessible. It's available, it's widespread. People don't think of this as a weird device to have on your body. Rings are the other area that we research quite a bit with. The Oura ring is the one that we use in, Dr. Lee uses, and we've used it in quite a bit of our studies, because again, people don't, and people particularly with dementia, a ring is something many people are used to wearing. Whereas putting a foreign object on someone can often be a problem. And I think it'll be even more revolutionary for diabetes management, when we can manage diabetes through a non-invasive watch. I think that's a game changer. Again, like, think of the invasiveness. Blood pressure cuff is not overly invasive. It may be uncomfortable, but it's not a blood draw.
Hi, you mentioned that your father is in a very rural area and in need of care. If it's not too personal, what devices is he using, or did you recommend for him?
Thank you. Thanks for asking. So this is, way too much disclosure, but I come from Louisiana. So he's also in a very rural southern environment. So Tyto Care, Ochsner healthcare system is in the South, and it was the first healthcare system in the nation in 2014 to integrate the Apple devices right into their EMR. So they are a national leader, and that is where my father gets his health care. So he had digital blood pressure cuffs before, like very, very a long time ago and cutting edge. So for his hypertension, it's been a game changer, because a health coach calls him when his blood pressure is high, a pharmacist calls him and will change his medications without us having to transport him. Again, 45 minutes. That's through a digital blood pressure cuff. The watch is really safety. With falls, it's alerted us, unfortunately, of a fall. He's, knock wood. So the Tyto allows for remote physical exams. It helped a lot with COVID, during COVID. The watch is a fall alert, as well as being able to call through voice command. And this was a professor of law who never touched a computer in his professional life, ever. So this was all 80 plus is when he learned. And I want to emphasize that, because we've done research on this at UCI. It is a myth, although we know in Pew that over 75 is the most digitally disconnected part of our population, bar none. That's the biggest barrier. But guess what? We did a study, and it's not that hard to teach someone. You know, we did coaching, we had students calling. People need support to learn, but I'm a professor. Everyone needs support to learn. So, I think there's been a lot of ageism, serious amounts of ageism around digital health. And my dad learned all of it and can navigate it. So, yeah, I hope that's helpful. And it makes me comfortable, because I actually have managed things from this far away. And his EMR has incredible data available, and I have access to that, so his labs or anything that goes on. Yeah, for distance caregiving, it's a big, it's a big game changer.
What is the main cause of dementia and how can you prevent it?
Of what? Dementia?
Yeah.
Oh, this is beyond my expertise, I have to confess. Dr. Gibbs will join. She apologized that I have to leave that to either Dr. Tam or Dr. Gibbs, one of our dementia experts. I'll tell you preventable things that we know. About 40% are modifiable risk factors, and those do tend to be cardiovascular. So if you're hypertension, if you have hypertension or you are hypertensive, let's manage that. Let's manage it. Don't ignore it. And I'm speaking to women as well, because as we know, cardiovascular disease has an enormous gender gap. And it's underdiagnosed and undermanaged in women, and we're working hard to change that. Active lifestyle. Take those extra steps, get moving. That is considered a modifiable risk factor for dementia. Social engagement. What you're doing tonight is good for your health. Thank you for coming out. It's really good for your health. We know that. We have research. So, Jung-Ah, have I missed other modifiable? I mean, if it's an interest, we can have Dr. Tam come and speak. We have a really stellar team of dementia experts, but the modifiable things, those would be high on my list. Yeah, and genetic testing. I mean, if you have it in your family, there are. It's not a large percentage, but there are genetic risk factors.
So you mentioned a lot of wonderful tools to maintain good health, active lifestyle. But I'm wondering, how good are these tools if you don't have a good internet system? Your father's in a rural area. He obviously has access to the internet. What about folks that don't have that? Do these tools, are you still able to manage yourself without that? Or how does that work?
Thank you for asking that. Thank you for asking that question. That's when we talk about a digital divide in this country. And it is a big one. Yes, if you do not have access to internet at all or mobile services, you will have a hard time with this. The proliferation of smartphones has been a game changer, because in the US today, we're about 85 to 87% proliferation. It's pretty widespread. California has, if you go to the California Department of Aging, they have a tremendous number of programs for low-income or older adults to get subsidized for internet. It's expensive, right? So there are programs to help individuals if the barrier is financial, if the barrier is geographic, meaning there is not, then it is a problem to have. If you have no cellular service and no internet, then it is assuredly. But California is pretty good in national terms, in terms of the numbers. I think we did a research study over at our federally qualified health centers. So UCI runs two. We're the only academic institution in the United States that runs a federally qualified health center, which means we care for about 20% of the most impoverished members of our community. And at our FQHCs, we were surprised, out of 30,000 patients, how few actually had a barrier on this point. It was a low number, but we still need to have it accessible for all. And so one of the things I'm trying to launch, I have not been successful, is I have a library of devices. I had federal grants, and I want to have a lending library, because maybe you want to work on hypertension and you want to work on your weight and staying active. I'm going to lend you a device. And we did this. We did a pilot. It was very successful. And then when you're finished with it, you bring it back in. So I'd like to have a lending library that makes digital devices available for anyone who wants to work on a health concern. I think it's a good model.
I'm curious to know how providers are going to handle all this data coming their way.
Fantastic question. They're not. Meaning, I'm not a computer scientist. I need to partner, and a lot of this is about AI and managing having experts manage data. We have to collaborate, like what we're going to use the data for, what's meaningful, but the actual managing of data. So some of the ways that healthcare systems do it is through AI, meaning I only get an alert if your blood pressure is out of range. And some dashboards are, it's a little high versus call now. So I think there is a lot being built right now, and I've been involved in building some of this with my computer science colleagues and my Epic analysts so that the data coming in is meaningful and actionable. But it takes a team, and we're really at the beginning of this, for sure. Great question, though. But a lot of what happens is technology develops apart from the medical teams, and that is also a very bad model. It needs to be together. I really have been advocating that. Everyone has to sit together, and the most important person in the room is the patient. That's, bar none, not the technology, not the healthcare. It's the person in the center and the families that are trying to use this.
I have an observation as well as a question. Just as war, we know, expedites technological advance, it sounds as if the pandemic truly expedited the research that's been done on this digital technology. And my other question, you sort of just let it drift by that in the future we wouldn't have heart attacks and strokes.
Yeah, I think that if we do much more upstream interventions, we're going to do a lot more preventive. We have a sick care system. I'm sure everyone has heard that. We do a great job late in the game. We don't have a great preventive care system. And that goes back to data, because if you think of the National Health Service or Canada, where we've met with some of our European colleagues, they have all the data. They know, and they're able to make actionable insights. And at the UCs, we are doing some pretty progressive stuff across all of our 5. We have an enormous healthcare system. If you think of San Diego to UCSF to UC Davis, UC Irvine, UCLA. And so I think the pandemic made us all start thinking quite seriously about a lot of these. We put a big burden on patients, right? Come to us. Brick and mortar, you come to us. You're in our hospital. And we need to think about people in the course of their life and where they live it and provide preventive early health care throughout. So a lot of work to be done, right? Which is what I always tell my students and my medical students. And they're like, you got a big job to do to take care of me. No, I'm kidding. But this is something that's going to take time.
Has there been some signs of how the pharmaceutical industry is going to interface with all of this technology? It seems like they have to be in the loop as well, right?
Yes.
Yeah.
Well, it's a great question. I don't have a lot of insight into the pharmaceutical company, other than that the pandemic was very hard for them because on the one hand, R&D went really fast around COVID. On the other hand, a lot of labs struggled because of the in-person piece. So we do think that there's been some lags that are there. But the role of pharmacists is pretty rapidly changing. And I see that pharmacists are really able to manage a lot more than in the past. And we're working much more innovatively. Like, you don't have a pharmacist visit, right? But we do at Senior Health Center. We have 2 stunning geriatric pharmacists, and they look at how medications interact and how to really keep people healthy with a lens of deep knowledge of the pharmacology behind things. So I think pharmacy and pharmacists and working in teams, it does take a team, but yeah.
This is very fascinating, and I have to ask, from a healthcare provider, is this technology a help or overload for the doctors, because we have to think about them too, and their lives and their tolerance and what they're doing?
It's a great question. I think my younger, we started a digital health equity task force, and I had so many medical students and residents and the young learners seeing this as an exciting thing. I do think for providers who are not, as I said, we've studied this, who don't like technology, it is a burden. EMRs are considered a burden for some of those. I think as with EMRs, though, our electronic medical records are a game changer. So if the data is too much, then we need more AI to break it down and make it more simple. And then it's a tremendous help, because it does help us manage chronic diseases. And we have a lot of good research on that. We have very strong research on that right now. So if you want to really manage hypertension or diabetes or COPD, the data helps us better manage. So most of my physician and nurse practitioner colleagues are all in on that. But there is a training, there's a time lag. And I do think about it like with paper or in rural health practices. But I think the research is pretty clear that particularly some of these things are necessary. They're better, they just provide better outcomes.
I was just wondering if it creates more work for you to gather this data, to connect dots and that sort of stuff.
You know, if I think of a case of hypertension, not really, again, because there's a dashboard. So if I have 1,000 patients I'm managing, the dashboard tells me which ones have readings out of range. So I'm not having to look through 1,000. So if the technology is designed with the provider, then it's tremendously helpful because I'm actually not having to look at everybody. I'm just focusing on the person who needs the extra help. It makes it more efficient. So I think, I don't know. Even in the hospital, I mean, I've had my years in the hospital where technology, long time ago, there was a lot of data and it was really hard as a nurse to be like, oh dear, I've got that coming in too. But most of us the reason we're in this field is to help patients. And if it is helpful, even if it's a lot of work to learn it originally, we're happy to learn it. And I don't think it makes for more overall work, like in the grand scheme of things.
Well, let me ask the other side of the question. What if you have providers that are recalcitrant, that won't use the technology and won't apply it? What are the consequences of that?
I don't know that I should answer that question. Okay, I'll go back to my rural dad. Because this is where I think it's really meaningful. If you feel that it benefits your health, then I think it's a problem if you're not working with a provider that helps you use that technology. And the example I have are paper charts. So the only problem with paper charts are that you miss things. And if you think about a paper chart where maybe a patient got one shingle vaccine, but they didn't get the second one, the EMR will alert you. This person needs their vaccine. When they come in, they need their vaccine. Yeah, so I think those are the sorts of things and the gaps that happen when a provider has a lot of paper files. And that's back to the work. It's very hard to go through paper charts. I was trained on paper. I'm that old, but it's a lot of work. Like our care decks, when I had to flip through like what medications. And when you've got a lot of patients in the hospital, when the computer puts that all up, it is big ol' help. So I would say that it's a partnership and seeking a provider. And the flip side of it is, as Amran is showing, and I'm not going to say this too publicly. Are you still recording? That, there's a lot you can manage on your own, increasingly. And the reason for that is value-based care, which we didn't have time to talk about. But basically, we are aware now, and COVID taught us, that most Americans live next to a CVS, or that healthcare is being provided in a lot of other settings than it used to be pharmacies are providing health care and urgent care. And so consumers have an enormous amount of power. So what you want is what you should get, is the truth. Because that is the future. That is the future of what we're seeing here, is that you can be an advocate in your own health care and what you want.
This evening you introduced a number of products that were approved in Europe and not in the United States. And I was curious if your opinion, if there's something about our healthcare system that's delaying new products coming to our market.
That's a great question. You know, I had the pleasure of spending a half day with the FDA, with all of them. I don't know that it's delaying, and I think caution is warranted. I want to see evidence. I mean, I think caution is important. So I don't have any expertise on comparing one to the other and why. But I think our system is fairly good and robust in terms of protecting patients. And I value that, whether it's a medication or whether it's a device, that it needs to be tested and validated with clinical trials to show that it's accurate and safe. But I'm sure there are experts who could answer your question so much better than I can in terms of like government bureaucracy and the burden on tech companies to get stuff through. And I know it is one. So I can't really say comparatively, but I did value what I saw our FDA, they're very cautious, as they should be. There's not a lot of room for error.
Okay, I think, is there one more question, or are we complete? Well, Dr. Rousseau, thank you so much.
Thank
This has
you
been.
all.
This is such valuable information. I want to draw it to your attention that this presentation will be on our website. So if you know people who can benefit from all of this digital wonderful breakthroughs that we've had in our own self-care, please share it with others. Our next meeting will be on November 13th. Dr. Judy Roche is going to be talking about understanding mental health issues, especially for older adults. So we hope to see you then, and go forward. Have a good evening.